Title: Pharmacokinetics versus Pharmacodynamics, Understanding how Drugs and Nutrients Interact. Welcome. In the next few minutes, we'll simplify pharmacokinetics, pharmacodynamics, and the key stages of drug handling in the body: absorption, distribution, metabolism, and elimination. We'll also explore how nutrients and foods can influence drug effectiveness and safety. Pharmacokinetics, PK, what the body does to the drug. Pharmacokinetics describes the journey of a drug through the body. It is often summarized as ADME, absorption. Movement of a drug from the site of administration into the bloodstream. Influenced by food intake, gastric pH, intestinal motility, drug formulation, drug nutrient insight. Calcium in dairy products can reduce absorption of certain antibiotics. Iron supplements can decrease absorption of some medications. High-fat meals may increase absorption of fat-soluble drugs. B. Distribution, movement of the drug from blood to tissues and organs. Influenced by blood flow, protein binding, body fat and water composition. Drug nutrient insight, low protein intake may reduce plasma proteins such as albumin, increasing free drug concentrations and toxicity risk. C. Metabolism, chemical modification of drugs, mainly in the liver. Enzymes convert drugs into active or inactive metabolites. Drug nutrient insight, grapefruit juice can inhibit drug metabolizing enzymes, increasing blood levels of certain drugs. Some herbal products and foods may induce or inhibit liver enzymes, altering drug effects. D. Elimination, removal of drugs from the body through kidneys, liver, bile, lungs, or sweat. Drug nutrient insight, hydration status affects renal drug excretion. Excess sodium or changes in urine pH can influence elimination of some medications. Pharmacodynamics, PD, what the drug does to the body. Pharmacodynamics explains drug mechanisms of action, receptor interactions, therapeutic effects, side effects and toxicity. Think of it as the relationship between drug concentration right-pointing arrow biological response. Drug nutrient insight, vitamin K can reduce the anticoagulant effect of certain blood thinners. Potassium-rich foods may increase the risk of hyperkalemia when combined with potassium-sparing medications. Caffeine may enhance stimulant drug effects. Why drug-nutrient interactions matter. Drug-nutrient interactions can reduce drug effectiveness, increase toxicity, alter nutrient absorption, cause nutrient deficiencies. Examples: antibiotics plus dairy right-pointing arrow decreased drug absorption. Blood thinners plus high vitamin K intake right-pointing arrow reduced anticoagulation. Diuretics right-pointing arrow loss of potassium and magnesium. Long-term acid-suppressing drugs right-pointing arrow reduced vitamin B12 absorption. Key take-home message: pharmacokinetics equals ADME. Absorption, distribution, metabolism, elimination. Pharmacodynamics equals drug effects on the body. Foods and nutrients can influence every stage of ADME and modify pharmacodynamic responses, making drug-nutrient interactions an important consideration for safe and effective therapy. Understanding pharmacokinetics and pharmacodynamics helps us predict how drugs work, while knowledge of drug-nutrient interactions helps optimize treatment outcomes and minimize adverse effects. Thanks for watching.